You could do like this.
Okay, folks, we're going to start here in a minute. Silence your cell phones if you would. I'm repeating myself, but we're going to be crisp and efficient today in the interest of protecting everybody's time. And I'll wait for the tick of 3 o'clock. And I will say you guys should have all received an email yesterday afternoon. So if you haven't had a chance to respond to that, I'd appreciate a response back to Francine. Good afternoon. We're going to call this Bridging the Gap Subcommittee meeting to order. First order of business is approval of minutes. I'd entertain a motion.
Support.
It's been moved and supported. Any questions, corrections, additions? Hearing none, all in favor signify by saying aye.
Aye.
All opposed, same sign. Is there any old business? Seeing none, we'll move along. Again, thanks for everybody that's taken the time to reply to the email that was sent out. I look forward to having more discussion interaction as we move forward. Because we have a very strict timeline today, I would like to invite our first presenter, the folks from the Michigan State Police Rhino Narcotics Proposal. Yes, Sheriff Bevere.
I am on the Rhino board, so I'm going to recuse myself from filling out forms and all of that stuff.
Thank you. I appreciate that.
I would move that the sheriff be recused for this meeting, this presentation.
Is there support?
Support.
Any discussion? All in favor signify by saying aye. Aye.
Aye.
All opposed, same sign. Thank you, Sheriff. Okay, sir, if you'd introduce yourself and make sure the green light is on in the microphone there so that our folks at home can hear, and you may commence.
Gotcha. Good evening. Thank you, Ms. Zisk, for inviting me here and the rest of the Bridging the Gap Subcommittee. Is that better? Thank you very much. My name is Detective Lieutenant Sean Street. I'm with the Michigan Department of State Police, the Rhino Narcotics Unit, Detective Lieutenant. Today with me here is Detective First Lieutenant Mark Moore. He is the First District Task Force Section Lieutenant, which oversees our office as well as some other multi-jurisdictional task force. So with that, I'll get into the proposal. Thank you again for letting me present this today. Incorporating and implementing an undercover narcotics team into the Lenawee County opiate settlement can be a crucial step in addressing the opiate crisis. The objective of the Rhino Narcotics Unit within the opiate settlement fund project is to effectively target, dismantle, and disrupt drug trafficking networks operating within the jurisdiction. By doing so, the team aims to achieve the following goals: targeting drug trafficking networks. The Rhino Narcotics team works towards identifying and understanding the various drug trafficking networks operating in this area. This includes mapping out hierarchy, supply chains, distribution networks involved in illicit drug trade. The Rhino team utilizes covert methods and undercover operations to infiltrate these networks, gaining insight into their operation, key players, and mode of operation. By actively participating in the networks, Rhino gathers substantial evidence to build strong cases against those individuals in drug trafficking. This evidence can be crucial in prosecution and dismantling the criminal enterprises. The Rhino unit focuses on gathering intelligence to identify high-level drug suppliers who are responsible for the bulk of the drug distribution within Lenawee County. We seek to uncover the major players involved in drug trade and understand their roles, connections, and methods. The team's objective is to pinpoint the target high-level drug suppliers who have a significant impact on the drug market. The strategic focus aims to disrupt the supply chain and undermine the influence and operation of these individuals. Our unit collaborates closely with law enforcement agencies to share intelligence gathering during these operations. This includes providing timely and accurate information about drug trafficking activities, key individuals, emerging trends, and new distribution methods. The intelligence gathered by the Rhino unit serves as a valuable and vital role for law enforcement agencies in these investigations. It assists in identifying additional targets, uncovering links between criminal organizations, and building cases for prosecution. The intelligence gathered by the Rhino unit contributes to the development of more effective law enforcement strategies. It helps agencies refine their approaches, allocate resources efficiently, and adapt their tactics to combat drug trafficking more successfully. By targeting and dismantling drug trafficking networks, identifying high-level drug suppliers, and providing valuable intelligence to law enforcement, the Rhino unit plays a vital role in reducing the ability and impact of the illicit drugs within the jurisdiction of Lenawee County. Our efforts align with the objectives of the Opiate Settlement Fund by mitigating harm caused by the opiate crisis and addressing the underlying issues related to drug trafficking. The Rhino unit should work closely with Lenawee County Community Development Coordinator and the subcommittee, and the Lenawee County Prosecutor's Office, our local law enforcement partners, who I refer to as our opiate response partners, to align their efforts with the overall goals of the program. Collaboration is essential for the successful integration of our team into the Opiate Settlement Fund. By working closely with our response partners, the team can align their efforts with the overall goals of the plan in mind. The opiate response partners should have a shared understanding of the goals and priorities outlined in the Opiate Settlement Project. This includes reducing harm associated with the opiate crisis, addressing drug trafficking, promoting treatment and recovery, and the prevention of opiate-related fatalities. Collaboration ensures that the efforts of the Rhino unit align with the strategies and incentives implemented by the Lenawee County Community Development Coordinator. This coordination helps avoid duplication of efforts and maximizes the impact of integrated approaches. Regular information sharing between the Rhino unit and our opiate response partners is very crucial. This includes sharing intelligence on drug trafficking activities, trends, key individuals identified during undercover operations. The exchange of information facilitates a comprehensive understanding of the opiate crisis and supports evidence-based decision-making. Collaboration allows for sharing of relevant data on substance use disorder, treatment outcomes, overdose incidents, and other indicators. This shared data can help identify areas in need, gaps in service, and emerging challenges leading to targeted investigations, interventions, and resource allocation. Collaborative planning and coordination allows for effective allocation of resources. By working together, we can optimize the use of funding, personnel, equipment, and other resources to achieve the greatest impact, reducing drug trafficking and addressing our opiate crisis. Collaboration brings together the specialized expertise of the Rhino Narcotics Unit and our opiate response partners. This collaboration allows for the exchange of knowledge, best practices, and innovative approaches, resulting in a more comprehensive and effective response to the opiate crisis. By combining resources and expertise, we can effectively target and dismantle drug trafficking networks, leading to successful prosecution and disruption of illicit drug trade. Collaboration with the Lenawee County Community Development Coordinator ensures that the information gathered during undercover operations can be used to identify individuals in need of substance use disorder treatment. Rhino can assist in referrals to appropriate treatment programs, ensuring that a coordinated approach is addressed both the supply and demand aspect of the opiate crisis. Collaboration sends a powerful message to the community, demonstrating a unified front in the fight against the opiate crisis. It enhances public confidence in the effort being undertaken and fosters community support for initiatives aimed at reducing drug trafficking and supporting those affected by the substance use disorder. By fostering collaboration among the opiate response partners, the integration of our efforts within the Opiate Settlement Project can achieve greater synergy, efficiency, impact, and this collaboration approach ensures the resources are leveraged, efficiently, intelligence is shared, innovation is coordinated, and the outlined goals of the plan are met. The Rhino unit should conduct covert operations to gather this evidence and build cases against major drug traffickers. This can involve infiltrating drug organizations, conducting controlled purchases, and gathering information through surveillance and informants. The team should focus on gathering intelligence related to the opiate crisis, including trafficking, identifying sources of illicit drugs, trafficking their distribution networks, and uncovering connections between suppliers in the local community. Based on the intelligence gathered, the team should prioritize target high-level drug suppliers and key individuals involved in the distribution of opiates. By focusing on disrupting the supply chain, the team can help reduce the availability of illicit drugs in the community. The Rhino unit should also collaborate with Lenawee County Community Development Coordinator treatment initiatives to ensure that the information gathered during these investigations can be used to identify individuals in need of substance use disorder treatment. This coordination can help facilitate referrals to appropriate treatment programs. Coordination with the treatment efforts is a crucial aspect of integrating an undercover narcotics team into the opiate settlement project. By collaborating with our opiate response partners, we can ensure that information that they gather during these investigations is used effectively and efficiently to identify individuals in need of substance use disorder treatment. This coordination can facilitate referrals to appropriate treatment programs and support comprehensive approaches to addressing the opiate crisis. The Rhino unit should also establish a strong working relationship with the Lenawee County Community Development Coordinator treatment initiatives, including substance use disorder treatment centers, clinics, and other relevant organizations. Regular and secure information sharing mechanisms should be established to ensure that the relevant data and intelligence that are shared appropriately and accurately with privacy regulations. The Rhino unit, through their investigations, can gather information about these individuals who are involved in drug trafficking, as well as those who are struggling with substance use disorder. By sharing this information with the Lenawee County Community Development Coordinator, who can help identify individuals who may benefit from the treatment and support services. Collaboration efforts should focus on establishing a seamless referral process to treatment providers throughout Lenawee County. This may involve developing protocols, guidelines for sharing information and making referrals, while ensuring compliance with office, department policies, as well as legal and ethical standards. The Lenawee County Community Development Coordinator treatment initiatives can provide guidance into Rhino's unit regarding available treatment options and programs. This ensures that the individuals identified during these investigations are referred to appropriate treatment facilities based on their specific needs, such as detoxification, medical assisted treatment, counseling, or residential programs. Collaborating with treatment initiatives can also involve ongoing case management to support individuals in their recovery journey. The Rhino unit, in coordination with the Lenawee County Development Coordinator and treatment providers, can monitor progress, provide updates, and ensure individuals relate to the necessary support services. Both the Rhino unit and treatment providers should receive training and education on each other's roles, procedures, and goals. This shared understanding enhances communication and collaboration, fostering a more effective and integrated approach to addressing the opiate crisis. The Lenawee County Community Development Coordinator can also analyze the data shared by the Rhino unit to identify patterns and trends related to substance use disorder, treatment needs, and gaps in service. This impact of the Rhino unit's effect on the treatment outcomes. Regular meeting and feedback sessions between the Rhino unit, the Lenawee County Community Development Coordinator, and the treatment providers can facilitate continuous improvement of the referral process. Lessons learned from the investigations can inform updates to treatment protocols and insights gained for treatment providers so they can enhance the effectiveness of the Rhino unit's operations. By establishing a strong collaboration between the Rhino unit, the Lenawee County Community Development Coordinator, and the integration of law enforcement efforts and treatment facilities and services, it can be maximized. This is an all-inclusive approach that aims to identify individuals in need, facilitate their access to appropriate treatment, and provide comprehensive support throughout their recovery journey. The Rhino unit should regularly share relevant intelligence and information with our opiate response partners. This collaboration will enable data-driven decision-making and evaluation for the effectiveness of the Rhino unit in reducing drug trafficking and addressing the opiate crisis. Data sharing and evaluation play a vital role in the integration of our unit into the opiate settlement project. The Rhino unit should establish a systematic process to share relevant intelligence and information with our opiate response partners. This includes providing updates and ongoing investigations, identifying emerging trends in drug trafficking, and sharing insight gained during these undercover operations. This shared intelligence can be analyzed collaboratively, combining the expertise of the opiate response partners. This analytics can help identify patterns, key players, areas of focus, contribute to a more comprehensive understanding of the opiate crisis and the effective strategies for intervention. By leveraging the shared intelligence obtained by all the opiate response partners, we can make informed decision regarding resource allocation. This includes directing funding, personnel, and other resources to areas of the highest impact potential in reducing drug trafficking and addressing the opiate crisis. The data obtained from the Rhino unit operations can inform the development of the targeted interventions to disrupt the drug trafficking networks. This may involve coordinated enforcement action, adjusting prevention and treatment initiatives, and identifying new strategies to combat these emerging challenges. Data-driven decision-making enables the implementation of evidence-based approaches to combat the opiate crisis. By aligning efforts with the data-driven practices, we can optimize the impact of their interventions and ensure resources are deployed efficiently. The Rhino unit's effectiveness should be evaluated based on an established performance matrix. These matrix may include number of high-level drug suppliers that are identified, drug trafficking organizations or DTOs, successful prosecution, seizure of illicit drugs, and or reduction in drug-related incidents or overdose fatalities. Regular assessments allow for measuring processes to adjust for strategies as needed. The opiate response partners should collaborate in evaluating the impact of Rhino units operations. This collaboration evaluation can incorporate data on treatment admissions, overdose rates, community feedback, and other relevant indicators to assess the overall effectiveness of the integrated approach. Evaluation findings should inform continuous improvement efforts. Lessons learned from the evaluation can guide adjustments to the strategies, tactics, and resources allocation of the opiate response partners to enhance their collective response to the opiate crisis. By fostering data sharing and conducting thorough evaluations, opiate response partners can leverage the insights gained from the Rhino unit to enhance their decision-making, implement evidence-based approaches, and consistently improve their efforts to reduce drug trafficking and address the opiate crisis. The collaboration and data-driven evaluation process ensures a coordinated and effective response to the challenges posed by the opiate crisis in Lenawee County and throughout Michigan. It is important to maintain transparency and communicate the effort of the Rhino unit to the public. This can help raise awareness about the ongoing enforcement activities, the damage or the dangers of opiate misuse, and the importance of seeking treatment. Public awareness is a crucial element when integrating an undercover narcotics team into the opiate settlement project. By maintaining transparency and efficiency, communicating the efforts of the team, important messages can be conveyed to the public regarding ongoing enforcement activities, the dangers of opiate misuse, and the significance of seeking treatment, and the significance of seeking treatment. There you go. Public awareness campaigns can help combat the stigma associated with substance use disorder and opiate addiction. By raising awareness about the nature of the addiction as a treatable medical condition, the public can better understand and support individuals in need of help. Public awareness initiatives can educate the community about the resources available for prevention, treatment, and recovery. By disseminating information about helplessness, treatment centers, and support groups, individuals struggling with opiate addiction and their loved ones can encourage to seek assistance. Public awareness campaigns can shed light on the important work of law enforcement, including the Rhino unit. By showcasing their effort to dismantle drug trafficking networks and reduce the ability of illicit opiates, the community can gain confidence in the actions being taken to address the opiate crisis. Develop and or obtain educational material such as brochures, posters, and online resources that provide accurate and accessible information about opiates, their risks, the signs of addiction, and available treatment options. These materials should be widely distributed in the community centers, schools, healthcare facilities, and other public spaces. Collaborate with local media outlets to raise awareness through news stories, press releases, interviews, and public service announcements. Feature stories about successful enforcement operations, personal recovery journeys, and community initiatives that address the opiate crisis can help gain and generate public interest and support. Utilize social media outlets, websites, and other platforms to disseminate information about the opiate settlement project's efforts, success stories, and the available resources. Engage with the community by sharing relevant articles, hosting live question and answer sessions, and promoting events related to opiate awareness and prevention. Organize and participate in community events such as town hall meetings, forums, and workshops to engage directly with community members. These events provide opportunities to address concerns, answer questions, and provide information about the work done to combat the opiate crisis. Collaborate with local organizations, community leaders, healthcare providers, and advocacy groups to amplify the reach and impact of public awareness campaigns. These partnerships can disseminate information, leveraging existing networks, and reach unserved populations more effectively. Regular evaluations of effectiveness of public awareness campaigns by tracking metrics such as website traffic, helpline utilization, and changes to public perception and knowledge about opiates. This evaluation helps refine messaging and strategies to maximize impact. Actively seek feedback from the community members, including individuals in recovery, families affected by the opiate addiction, and community leaders. Their insights and expertise can inform future awareness initiatives and ensure that the messages resonates with the target audience. By maintaining transparency and engaging in the public through various awareness strategies, the integration of the Rhino unit can benefit from community support, increase help-seeking behavior, and reduce stigma surrounding opiate addiction. Ultimately, public awareness initiatives play a significant role in fostering a supportive and informed community response to the opiate crisis. To allocate funding, allocate a portion of the settlement fund to support the operation of the Rhino unit, including a portion of personnel salaries, training, equipment, and operational expenses. Continual funding will ensure stability and effectiveness for the team's efforts.
Okay, we've reached the end of our 20 minutes, sir.
Very good.
Just so I can put this in a quick context, because we didn't get into the specifics of your proposal, but for the people listening at home, it looks like the request is for $80,000. And as I look through this, it looks like roughly 45,000 is for vehicles and uniforms and safety equipment. 12 and 6,000 will be split between the county sheriff's department and Adrian Police, and then a few $1,000s each for building alarms, GPS trackers, and training. Is that?
That's accurate, yes.
Okay. Okay, I would open it up to anybody that has questions now. Commissioner Collins, excuse me, Terry.
I have several, and I don't want to hog this up, but have you applied elsewhere for these funds? Every county has received funds. Have you applied elsewhere for these?
We have applied for the Burn JAG grants, a federal grant, but nothing.
Opioid settlement funds.
I'm sorry.
Opioid settlement funds.
No, nothing for the opiate settlement funds. No.
And you're saying you'll be operating only in Lenawee doing this?
We cover Lenawee County and Hillsdale County. Our primary role and responsibility is Lenawee County. We do get to help Hillsdale County quite often.
Well, these funds will be used in Lenawee and in Hillsdale County.
These would be to support the team. So wherever the investigation would lead us, stemming from our Lenawee County investigations, not to say that none of the equipment that we would use to buy this would be used in Hillsdale County. However, it would help to support any narcotics related suppliers from Hillsdale County into Lenawee County.
And may I go on?
Absolutely.
I went over this a few times, and it's listed in the application as a new program, and I'm stretching to find out how it's new. How is it different than what you've been doing since 19?
Sure, yeah, for a very long time. Yeah, very long time. So our operations and what we do in the community are exactly the same. The only thing that would help support is the communication bridge between facility. It's bridging the gap essentially. Law enforcement has a role and healthcare providers have a role, but somewhere in between, people who have substance abuse disorder, they don't hit that mark. What we need to do is come up with a unified way of finding a place for these individuals, whether it be medical treatment or residential, or, you know, sitting down and talking to a doctor about some mental health issues.
You're looking at one-time funding or ongoing funding?
I would prefer an ongoing funding, but as I was talking about in my proposal, if I get this one-time funding, we can measure the matrix and maybe reestablish maybe additional funding if it is working. And I don't want to throw money at a problem just to throw money at it. I want it to work. I want it to actually work. So if this program is not working, I wouldn't even dare come back and ask for additional funding if the program's not working. So.
Very good.
Other questions? Brana?
Yeah, thank you. I have just a question towards the end of the presentation and in some of the materials. A lot of this is the data gathering and the information and intelligence gathering aspect of this work. That sounds like that would be the newer part of what you already do. And towards the end, it was mentioned it could be communicated at town hall meetings and with community partners and providers, et cetera, through social media. And also the insights could be used to target future resources.
Sure.
So where would those insights gained be housed? Because that was a key part of the public awareness piece.
Where would, what?
Where would that be stored? Who is going to maintain and monitor all of the information gathered so that it's accessible for all of these external partners?
Sure, yeah, and that's something that we'd probably have to work out between all of us, exactly who needs this data. We do have a lot of data. The state police and our multi-jurisdictional task force, we have a lot of data. We use it internally, and sometimes we are a little hesitant to provide that data because we don't exactly know what we should say and what we shouldn't. What I need to do is have a good avenue where that information is going to go. And so that's actually a further discussion that we probably need to have to work out this network of where this information would be best suited, and probably a little bit more data on our end as far as people who have substance abuse disorder, and we can recognize that. So I think through some training for us to recognize that and maybe find an avenue of where this data is going to go. But I do agree, it does deserve further discussion on where that is going to be housed and take place and how it's going to work, for sure.
I saw other questions on this side. Did Judge Morgan or Sarah, go ahead.
I think it's a pretty basic question. In several of your slides, I noticed you, or it was worded should. You should be currently or should work with community coordinator, prosecutor, law enforcement agency, et cetera.
Mhm.
I just wanted to make sure, are you not already doing that? Is that something that will be added on in, speaking with the collaboration part of it?
Yeah, I think that we have a clear communication with all of our law enforcement partners, our neighboring jurisdictions, prosecutor's office. We already have that clear communication. It's more specifically geared towards the opiate crisis.
Right.
On the conversations we should have on progression of treatment facilities and just identifying data and who needs what, where. And that's probably the first step of the process, is identifying where we need data and now what can we do with that data.
Okay.
I think it's going to be a slow process to start, but I think that it would just be more conversations with those individuals regarding the opiate crisis.
Understood.
Yeah.
Thank you.
No problem.
Other questions?
Yeah, I have one.
Tim?
You mentioned there's barriers in communicating with treatment providers and medical professionals. So what are those barriers that you're experiencing now, and how would this overcome them?
Yeah, I would say almost non-existent, because as a law enforcement officer, I know that there's facilities there. For one, I think we need to change our mindset a little bit about how we react with individuals there on the street. And two, be more aware and have more communication with these facilities to understand the hours of operation, who will they accept, and if they're full, what's our second choice, right? So there have been some individuals that we've come across that needed help, and I've sat and talked to them on the front porch, and they say, hey, I just want to get out of this lifestyle, but I have no support group. I have no family here. And I've reached out to a couple individuals, and sometimes it works and sometimes it doesn't. I just don't think that I have enough information. And I think that's kind of what this proposal is to kind of seek that information out, right? The funding is to support our team and to do these investigations and gain intelligence and share. But the very root of it is to find these individuals during those operations and provide those facilities and information to them.
Okay, we got a couple minutes left. Other questions? Judge Morgan?
When you say to seek out and find those informations, I'm looking at your expense items and opioid settlement funds proposal. A number of it is like vehicles, some to the Lenawee County or the Adrian Police Department, the Lenawee County Sheriffs. I see training for those entities at 2,500 out of this 80,000, and then for Rhino training at $625. I guess when I look at this and what you're saying, it seems as though training and a determination of what resources are available, and if we're trying to assist individuals that have opioid crises, or if Rhino currently is a primary law enforcement activity seeking out, and obviously we do agree
Yeah.
the upper echelon of the drug trade we want to intercept, but how are you directly impacting the individuals that are in crisis in Lenawee County with these funds?
Sure. Two fronts on that. And now with the funds, obviously the funds from our unit doesn't go towards the individuals seeking treatment, right? It would be to support our unit to continue and to investigate these individuals. But to answer your question on two fronts, so the high-level narcotics dealers, I've heard, I've sat down with many mothers and fathers who have lost people to opiate crisis. And they were kind of pushed that way. They got addicted to pills, and then somebody in that circle said, hey, I have something else for you, right? So it's not just that they're trafficking narcotics, they're pushing narcotics onto new users, right? So if we can target any level drug dealer and get them and remove them off the streets, that might be one more individual who does not start getting addicted to opiates. Another front on that, during our investigations, it allows us to make contact with those individuals who are not high level. They might be street level dealers who are also addicted, who need help as well, right? So that'd be like kind of the two fronts. So it'd be supporting what we already do with the funding and our equipment, being able to take those drug dealers off the street, so it's really not pushed down to other individuals during those interactions.
Thank you. We've unfortunately reached the limits of our time. I warned you in advance we'd be strict. And of course, we want to give time to the next folks. Again, if you have follow-up questions for this gentleman and their proposal, feel free to send them an email, and I'm sure they'd be glad to interact with you further. Thank you for coming, and thank you for your
Thank you all.
time.
Take care.
Next, we're going to call forward, hopefully I got the right lady, Rachel Dokstatter. I know how to say it in German. I don't know how you say it in English. You are with, forgive me, you are with Catholic Charities of Jackson, Lenawee, and Hillsdale counties. Thank you for coming today, and thank you for your proposal.
Good afternoon.
Good afternoon.
It is Rachel Dockstader. I'm here as an SUD case manager with Catholic Charities. I'm also the case manager for Lenawee County Recovery and Sobriety Court here. I was licensed foster parent for nearly a decade here with Lenawee County. Excuse me. During that time, I welcomed about 30 children into my home who have experienced disrupted placement, significant trauma. My home was often referred to as the last stop before residential for those children. I didn't just foster children, I trained foster parents by teaching them about trauma and brain development, helped build GROW training still used today. I am the proud mom of 10 incredible children. 6 boys, 4 girls, ranging from a 6-year-old nonverbal autistic son to my oldest who works for the county here in Lenawee. I continue to be involved in the foster care system as a mentor to current foster homes with DHS, as well as working in their recruitments. I was once told that if you want to influence people, they need to know who you are and why you care. So I've shared with you who I am. Now here's my why. We consistently see families both in SUD treatment, in the court programs, and in foster care who need focused, practical, and trauma-informed support. Research clearly shows a strong connection between substance use and the involvement in the child welfare system. Bless you. Substance use and trauma are often deeply intertwined, and when children are part of the picture, the consequences are even more profound. This is something I witness daily in my role, both as a case manager and experience firsthand as a foster care parent. I am a daughter, a sister, a cousin, and a niece to individuals who battle substance abuse disorder regularly. The parents that we serve were once children themselves, and many carry unresolved trauma. Now more than ever, they deserve the support, empathy, and healing that they were denied in their own childhood. We're here to request funding through your coalition to support a new trauma-informed psychoeducational program we believe to make a meaningful difference in the lives of families impacted by substance use and Child Protective Services involvement. Catholic Charities has served Lenawee County since 1958. We've provided substance use treatment here since 2003. We are deeply rooted in the community and commitment to addressing the complex challenges that our local families face. So in your packet, you're going to find our numbers for 2024 for Catholic Charities. It's all the way to the back. We've delivered 6,504 units of substance use and mental health services in our 3 counties. We have our child advocacy centers who conduct 373 forensic interviews last year. 120 of that, 5 of those happened here in our county. Our foster care program consistently serves approximately 35 children each month, and we have our roadmap to graduation program supporting students who need extra guidance and resources to successfully reach high school graduation. In Lenawee County and across the nation, many parents in the CPS system are fighting battles on multiple fronts: addiction, loss, shame, fear of losing or not regaining their custody of their children. Unfortunately, these services often addressed in silos. They're addressed independently. The result of this is a relapse, reentry into the CPS system, and long-term instability for our children. This is the gap that Catholic Charities would like to fill. We're proposing a seeking safety-based psychoeducational program. It is an evidence-based trauma-informed intervention specifically designed to help people with co-occurring trauma and substance use issues. Our program will serve parents involved with CPS who have a history of substance use. It will run as a weekly 1-hour group over 8 weeks. Using our Seeking Safety model, participants will learn practical coping skills to manage trauma, reduce the risk of relapse, and build a healthier future for themselves and their families. Our primary objective is to reduce the reoccurrence of CPS involvement and promote sustained sobriety among these parents. To evaluate that impact, we'll use screening tools, including but not limited to the MAST, DAST, and ACEs before the program entry. We will also collect participant feedback upon completion and follow up 6 months and every year after. Successes will be measured by the group completion rates, sustained sobriety, and most critically, reducing re-engagement with CPS. Catholic Charities will contribute in-kind support, including the space in which we operate and the administrative resources. This is a new program, but it is rooted in proven practices. Seeking Safety has been implemented nationally with positive results, especially among those populations dealing with trauma and substance abuse. By funding this project, you're not just investing into a program, you're investing in long-term healing for families. You're helping to break the cycle of trauma, addiction that passes from one generation to the next. Now for questions.
Great, thank you. Very efficient use of time.
I'm fast. I talk fast. And a conversation is more what's needed anyway. Other than
Agreed.
me telling you what you already read.
Commissioner Collins.
It's the same question before. Have you applied elsewhere for these funds?
Have I? No, I have not.
Has Catholic Social Services?
Catholic Charities says not.
I'm sorry.
No, sir.
You serve other counties?
Am I sure about the counties?
Do you serve other counties?
Yes, Hillsdale and Jackson County as well as Lenawee.
Those counties.
No, sir.
I'm curious, as I was reading your application, the timer that showed, you mentioned that you'll start with a group. If another one is needed, you will add that. How does that affect the budget you're asking for?
Currently, we're gonna run one class. All of the supplies, the budgets that we went over were double. They're reusable, right? So my space is not gonna change. The cost, whether I run one or two groups, is not gonna change. The supplies don't change.
So if you add a second group, the supplies are not a problem. They are not duplicative.
No, because I can run 60 people in a group.
How about personnel? Is that an added cost?
It would be long-term. In the beginning, I only need myself.
Other questions? Abrana?
Yes, thanks. For these funds in this program, would all of those served be in Lenawee County? In other words, would these funds be used for those in Lenawee County only, or all three counties?
Yes, at this time, we're only looking to serve Lenawee County.
Other questions? Sarah?
Can you give us some examples of the types of material from the Seeking Safety program that you'll be using? I see the program was established back in 1995, if I remember correctly. So, I am supposing that has a pretty good record, without really looking too deeply into it, but can you just give us some examples?
So each program would include a workbook for the participants. A lot of it is take-home work. Therapy doesn't happen in the hour they're with us. It happens at home. It happens when they make the change decisions. Most of the supplies would be the workbook. Got it. And activities, we are looking to do like a graduation certificate and things of that nature.
Yes, sure, absolutely.
Okay. I was just out of curiosity, how does your referral system work with CPS right now? Are all CPS type cases referred to you guys? Is that shared around the county with other entities? How does that work? And they're gonna, I guess what I'm trying to say is, are there gonna be a lot more cases that have been referred to CPS that won't fit into the program? Or do you think you'll be able to get the majority of those types of cases, if that makes sense?
So it would depend on what we're actually talking about referrals. Referrals for kiddos in care go to all the agencies. This is a new program, so I don't know how they would do that. There isn't anybody else doing something of this nature. There are other parenting programs, not just this type of program.
Okay, because you'll be working mostly directly with the parents and then from there. So I think I understand.
Okay.
Thank you.
Oh, okay, well, let's go to Tim.
Just to try to clarify, so lost my train of thought. The,
Welcome to the.
yeah, the families you'll be serving, they're not just going to have opioids as an issue. It's any substance abuse, involvement with protective services. So that typically is, with this group, would be something new from what is being offered anywhere else in the county.
So the gap for me, as a foster parent, what I saw was our foster parents get a plethora of training, right? We have all these opportunities that are handed to us. If we're talking about biological parents, they get a pretty standard PMTO training, parent training, right? Which is great. But if you don't understand how substances has affected you, you cannot transfer that knowledge to how it has affected your family or your children. So that is the shift.
Thank you. Judge Morgan?
You mentioned a workbook. Do you have a specific workbook in mind at this point, or would that be something that would have to be developed?
Nope, so we're gonna use Seeking Safety as the base of our program, which is its own curriculum. It's already created, has its own workbook, handouts, and program.
And then are you seeing the vast majority of participants coming from CPS, or would it also be available to others in the community that hopefully are not yet involved with CPS, but want to improve or deal with their own issues?
I think anybody that wants to come can come. We're not at the point where I'm gonna limit who can be there. What we're looking to establish is a program where parents can come in and understand what substance abuse does to their family and their parenting and their children. So most of them would probably come from CPS. Currently, we get a lot of our substance abuse referrals from CMH, and those are our priority clients out of there. Anybody with CPS involvement or possibility of involvement are priority clients. So between CMH and CPS, I believe so, yes.
Commissioner Collins?
I noticed in the application, I don't remember the number, but in the application, there was no listing for sustainability. How would you intend to sustain this program?
So currently, the plan is going to be a Catholic Charities would pick it up and fund that. Ideally, we would then research other grants coming through and or the possibility of a partnership with DHS or something like that. There are other avenues for us to explore.
Okay. So, but there's nothing firm yet. You're looking
No, there's not.
possibility.
Actually, Judge Morgan asked my question about whether CPS was the only referral that you would take, so I understand that. Okay, thank you.
I have a question. I believe I know the answer by the name of your entity, but you're a nonprofit,
Yes,
and I would presume a very low overhead.
yes,
The high percentage of this money is going to go directly to the point of need with people directly caring for people at risk.
correct.
Super. Any other questions? Sure, Tim.
What kind of, two things, what types of things are you offering as follow-up for the parents? And what is being done to support what will be done to support the children of the parents that will be part of the groups?
When you say follow-up, are you talking about continued care?
Yeah, because I know that you say in here 6 months and 1 year, evaluations of how services were received and used. But is there any plan to follow up and provide aftercare for those families that participated in the group?
I think that decision would be made once we see what they need, right? We can't guess or try to ascertain what they need at this time. But with our substance abuse program, they're always able to come back. There's never a one and done kind of out the door situation. Substance abuse is long-term. It's lifelong. It doesn't end at the end. And I forgot your second question, the children. Currently, we have 2 child therapists. That's always an option. Most of our CPS referrals have Medicaid, which means the children would also, and if they're in care, they have Medicaid. They would be able to be seen at our facility as well.
Thank you. Anything else from anybody? Well, thank you so much for coming and sharing your presentation with us. Again, folks, if you have additional questions, feel free to email. And thank you for your time today.
Thank you so much.
Anything from anybody before we move on to our next step? Okay, good. Next, of course, is public comment. Is there any public comment? That was my biggest fear with a hard 59-minute limit, because if 50 people showed up to give public comment, guess what? We're going to be here a long time. There is commissioner comment there. I would ask that in the future we strike that from our agenda. Let me just say, before we take a motion to adjourn, again, we've had some discussions in an email talking about process. And again, it was a privilege. I knew some of you, but to get to talk to you all one-on-one, to appreciate your passion. I've told Francine and Administrator Murphy that, You know, we have a team of A students here sitting in this room with tremendous depth of knowledge and experience far beyond my grasp of these issues. And I'm excited about what we'll be able to accomplish. Also know that Francine and I and the rest of the staff, as we all talk, we are open to continue to refining the process, to sharpen the process, to streamline it. And you guys are an integral part of that development process. So please continue to reach out by email or call me or Francine. We're sharing information with each other, and we want to make this the very best that we can as we continue. So we got a couple minutes. I don't want to extend this too much, but is there any final comment or anything at all? I really thought we'd be right at 4 o'clock. Well, thank you so much. I would entertain a motion to adjourn.
So moved.
Been moved and seconded. All in favor signify by saying aye.
Aye.
All opposed, same sign. Thank